Oral Health for an Aging Population. Evidence, Policy, Practice and Evaluation is the first edition of a book by Kakuhiro Fukai, published in 2025 by Wiley-Blackwell, an imprint of John Wiley & Sons. It belongs to the fields of geriatric dentistry, dental public health, and health policy, and is intended for dentists, other healthcare professionals, researchers, policymakers, and students. The author integrates scientific evidence, clinical practice, public health policy, and evaluation, examining oral health in older adults in relation to nutrition, frailty, cognitive decline, social participation, and access to care. In the preface, he clearly states that he wants the book to be useful to clinicians, healthcare professionals, policymakers, and students, treating evidence, practice, policy, and evaluation as components of the same process. 7 chapters progress from global population aging and the clinical assessment of older adults, through the relationship between oral and systemic health, to the Japanese model of universal healthcare, international comparisons, and healthy aging policy. The structure is logical, and for dentists the second and third chapters are the most valuable because they examine oral function, nutrition, frailty, cognitive status, dementia, and the relationship between oral and general health in detail. The scientific ambition of the book is substantial. The author distinguishes between observational and interventional studies, systematic reviews, and meta-analyses, and explains that the strength of a conclusion depends on study design and on whether a study merely identifies an association or actually investigates a causal relationship. The literature includes cohort studies and randomized controlled trials, systematic analyses, and international and national guidelines, with some sources updated through 2024. However, the quality of the evidence is uneven. The high prevalence of oral diseases, the association of tooth loss and impaired oral function with nutrition and quality of life, and the need for a comprehensive assessment of older patients are well supported. The evidence is much weaker that a dental intervention by itself prolongs life, prevents dementia, or reduces chronic systemic diseases. No independent external literature search was conducted for this review, so it is not claimed that every recommendation has been independently confirmed against the latest guidelines beyond the sources cited in the book. Based on the available sources, this cannot be assessed reliably. The most important weakness is the occasional transition from association to a causal conclusion. The author, for example, reports a very strong correlation between the average number of remaining teeth and life expectancy in the Japanese population and then concludes that a greater number of teeth clearly contributed to longer life. The data alone do not establish this. The number of teeth may be a marker of socioeconomic status, access to treatment, health behavior, diet, and general health. Similarly, the concluding statement that maintaining oral health has been shown to contribute to the prevention of chronic non-communicable diseases, cognitive decline, and frailty sounds stronger than the methodological limitations discussed earlier would justify. The most useful clinical recommendation concerns the assessment of older patients. The author proposes that, in addition to examining the teeth, periodontium, and prostheses, the dentist should assess diseases and medications, cognitive function, vital signs, activities of daily living, muscle strength, respiratory function, oral hygiene, salivary function, mastication, and swallowing. Multimorbidity, polypharmacy, and functional limitations directly affect treatment planning. It is particularly useful that the book does not treat oral function as an abstract concept. It describes the assessment of mastication, observation of the patient while eating, evaluation of the types of food the patient is able to consume, and several levels of swallowing assessment. However, threshold values for individual assessment instruments should not automatically be transferred to populations in which they have not been validated. The author himself states that the reliability and validity of some methods for assessing oral function still need to be improved. Another important recommendation is that prosthetic treatment of an older person should not end with delivery of the prosthesis. Tooth loss and impaired mastication are associated with a more restricted food selection and less favorable nutritional intake, but providing a prosthesis alone does not necessarily improve nutrition. The author cites randomized controlled trials supporting the combination of prosthetic treatment with nutritional counseling, while at the same time acknowledging that a large proportion of the evidence concerning the relationship between oral health and nutritional status comes from observational research. Restoring occlusal function therefore creates the possibility of improving food intake but does not guarantee a change in dietary behavior. A third important area is dementia. The book recommends adapting the treatment plan to the degree of cognitive decline. In the early stage, the oral condition should be stabilized and future ability to maintain oral hygiene should be considered. In the moderate stage, treatment should be simplified and shortened, with family members or caregivers involved. In the severe stage, comfort, basic oral function, and minimally burdensome treatment become the priorities. This is practical and supported by the guidelines cited in the book. The claim that prevention of tooth loss probably prevents or delays dementia is much weaker. At one point, the author explicitly acknowledges that there is insufficient long-term research on the effect of regular dental maintenance on dementia prevention and then states that the evidence linking tooth loss and dementia is based only on observational studies. Professionally, it is therefore appropriate to say that poor oral health, tooth loss, and cognitive decline are associated, but not that tooth preservation has been proven to prevent dementia. A fourth useful concept is the early recognition of oral problems and disorders of mastication and swallowing. Longitudinal studies cited in the book associate minor impairments in oral function with subsequent physical problems, dependence on long-term care, and mortality, although the author also cautions that assessment instruments still require improvement. In clinical practice, this means monitoring changes in food selection, mastication, tongue mobility, salivary function, coughing during meals, and swallowing, rather than focusing solely on the number of teeth. A fifth recommendation is systemic. Oral health care for older adults should be integrated with medicine, nutrition, long-term care, and public health. Japan is the central example in the book and demonstrates how dental care can be incorporated into broader healthy aging policies and universal health care. However, Japan is not a universal model. Financing, demographics, and healthcare organization differ among countries. In addition, the author states that the review of healthcare systems in Western countries is based largely on reports and government data from the period between 1995 and 2019, meaning that some organizational and financial details must be verified before being applied today. The book has four major strengths. The first is its functional perspective on geriatric dentistry, shifting the focus from the number of teeth to a person's ability to eat, speak, swallow, and maintain oral hygiene. The second is its multidimensional assessment of older patients, which is particularly useful for younger dentists. The third is its open acknowledgement of the limitations of the evidence in the areas of nutrition, dementia, and systemic health. The fourth is its connection between the dental office and the healthcare system, emphasizing that individually high-quality treatment is not sufficient if vulnerable patients cannot access care. In addition to the occasional overstatement of causality, the main weaknesses include substantial reliance on Japanese populations and on studies conducted by the author and his collaborators, which requires confirmation in other settings. The book is not a systematic review with a predefined search strategy, formal risk of bias assessment, and grading of every recommendation, so it cannot be assumed that all conclusions are supported by the same level of evidence. Dentists expecting detailed procedures for the treatment of caries, periodontal disease, implants, or prosthetic rehabilitation in older adults will not find them here. For students, the book provides a good framework for understanding aging and oral function, but it is not a substitute for a conventional textbook. Younger dentists and general practitioners will benefit most from the sections on functional assessment, nutrition, and dementia, while residents, specialists in geriatric and preventive dentistry, dental public health professionals, and university faculty are likely to gain the most from it. The three most important professional concepts are that the number of teeth alone is not an adequate indicator of health in an older person and that function must be part of the examination. That prosthetic or restorative intervention has limited value if it does not contribute to better nutrition, hygiene, and daily function. and that the relationship between oral and systemic health should be taken seriously, while statistical association should not be presented as proof of causation. The book deserves a place in the professional library of colleagues who frequently treat older patients, particularly those working in geriatric dentistry, public health, or education. Dentists primarily looking for a surgical or prosthetic atlas can reasonably skip it. Its greatest value lies in expanding the clinical perspective from the teeth to the functional health of the individual and the healthcare system. Its greatest weakness is the occasional overly confident interpretation of observational associations. It works best as an interdisciplinary textbook and supplementary reference rather than as a procedural clinical guide. Is it worth the time required to read it? Yes, if it is read critically, not because it provides a definitive answer to how much oral health prolongs life, but because it clearly demonstrates the questions contemporary dentistry must ask as patients age.